everyone wants to know the same thing: which medication actually works best for harder, stronger erections? I'm Dr. Eva Danial, a urology and men's health expert. Today, I want to walk you through what the science really says about the most common erectile dysfunction medications, which ones tend to work best, and which ones might be the right fit for you. You've probably heard of Viagra and Cialis. Viagra's generic name is sildenafil, and Cialis is tadalafil. These are by far the two most commonly prescribed medications for erectile dysfunction. But there are also a couple of others: vardenafil, sold as Levitra, and evanafil, sold as Stendra. So which one is better? Which works faster, lasts longer, and has the fewest side effects? Let's start with the basics. All four of these medications belong to the same family, PDE5 inhibitors. They all work by helping your blood vessels relax and open up, allowing more blood to flow into the penis. More blood flow means better, firmer, longer-lasting erections. They've all been studied extensively, and for most men, they're safe and effective. That said, there are two important cautions. First, if your doctor has told you that it's not safe for you to have sex because of a serious heart condition, do not take these medications. And second, if you're taking nitrate medications like nitroglycerin for chest pain, never combine them with Viagra, Cialis, or any other PDE5 inhibitor. The combination can dangerously drop your blood pressure. Now, let's talk about what the research actually shows. One large review looked at 82 clinical trials involving over 47,000 men to compare how well these drugs worked, and another 72 trials involving 20,000 men to look at safety. Across the board, all of the medications worked better than placebo, meaning they all significantly improved erectile function. But there were some interesting differences. At the standard starting dose, sildenafil 50 milligrams, that's Viagra, produced about a 47% improvement in erectile function compared to placebo. Tadalafil 10 milligrams, or Cialis, improved function by about 33%, while vardenafil 10 milligrams showed around 35%, and evanafil 100 milligrams was around 29%. So Viagra came out slightly ahead in terms of raw efficacy, but there's a trade-off: more side effects. The most common ones were headache, flushing, nasal congestion, and upset stomach. Sildenafil 50 milligrams had the highest overall rate of side effects at about 18% of men. Cialis 10 milligrams had the lowest, around 10%. So Viagra tends to be a bit stronger, but Cialis is generally easier to tolerate. That's why many men prefer Cialis, especially if they want something that lasts longer. And that's another key difference. Viagra works fairly quickly, usually within 30 to 60 minutes, but it wears off after about 4 to 6 hours. Cialis takes a little longer to kick in, but it can stay active for up to 36 hours. That's why it's often called the weekend pill. Some men even take a very low dose of Cialis every day, usually 5 milligrams, to keep a steady level in their system. That daily approach can help improve natural blood flow and make erections more reliable over time. And if needed, you can still take an extra on-demand dose, like 10 or 20 milligrams, for a boost before sex. As for Levitra and Stendra, they both work, but they're not used as often. Levitra is similar to Viagra in duration, and Stendra tends to be the fastest acting of the group, sometimes working in as little as 15 minutes. But it's also the most expensive and a bit harder to find. Now, you might be wondering, does a higher dose mean better results? Not necessarily. In that same analysis, going from 50 to 100 milligrams of Viagra didn't make a big difference in how well it worked. In fact, the improvement was almost identical, but side effects were slightly worse. Same story with the other drugs. Higher doses sometimes help, but not always, and they increase the risk of side effects. So here's the bottom line. If you're looking for the strongest on-demand medication, Viagra 50 milligrams tends to perform best overall. If you want something longer lasting and easier on your stomach, Cialis 10 milligrams or a daily low dose of 5 milligrams is an excellent choice. If you're sensitive to medication or you've had headaches with Viagra before, Cialis is usually better tolerated. And remember, these medications don't create sexual desire. They support the blood flow response. You still need arousal and stimulation for them to work. As always, make sure your doctor checks your blood pressure, your cardiovascular health, and your medications before starting anything new. Before we finish, a quick note. If you want to naturally support erections, testosterone, and prostate health, I've listed 4 powerful supplements I personally recommend for my patients in the pinned comment below. They're completely natural and work beautifully alongside prescription medications or lifestyle changes, helping you build stronger, more reliable performance from the inside out. So to sum it up, Viagra works great but can cause more side effects. Cialis lasts longer and tends to be gentler. Levitra and Stendra work too, but they're less commonly used. And what really matters is how you feel, what works best for your body, your schedule, and your comfort. Beyond medication, lifestyle changes can make a profound difference in erectile function. Regular exercise, especially cardiovascular activity, improves blood flow throughout your body, including to the penis. Maintaining a healthy weight reduces the risk of diabetes and heart disease, both major contributors to erectile dysfunction. Managing stress through mindfulness, therapy, or relaxation techniques can also help, since anxiety and depression often play a significant role in sexual performance. Quality sleep is essential too. Poor sleep disrupts hormone production, including testosterone, which is vital for sexual health. And if you smoke, quitting is one of the best things you can do for your erections. Smoking damages blood vessels and restricts blood flow, making it much harder to achieve and maintain firmness. These lifestyle factors work hand in hand with medications, creating a comprehensive approach to better sexual health and overall well-being. I also want to address something that doesn't get talked about enough: the psychological component of erectile dysfunction. Many men assume that if they're having trouble with erections, it must be purely physical. And while physical factors are certainly important, mental and emotional health play an enormous role. Performance anxiety is incredibly common, especially after experiencing erectile difficulties once or twice. That initial worry can create a self-perpetuating cycle where the fear of not being able to perform actually makes it harder to perform. This is where open communication with your partner becomes invaluable. Talking honestly about what you're experiencing can relieve so much pressure and strengthen your relationship at the same time. Therapy, particularly cognitive behavioral therapy or sex therapy, can be transformative for men dealing with the psychological aspects of erectile dysfunction. A trained therapist can help you work through anxiety, rebuild confidence, and develop healthier thought patterns around sex and intimacy. Sometimes couples therapy is even more beneficial because it addresses the dynamic between partners and ensures you're both on the same page. It's also worth mentioning that erectile dysfunction can sometimes be an early warning sign of other health conditions. Because the blood vessels in the penis are smaller than those in the heart, problems with blood flow often show up there first. If you're experiencing erectile difficulties, it might be your body's way of telling you to get a comprehensive health checkup. Conditions like high blood pressure, high cholesterol, diabetes, and hormonal imbalances can all contribute to erectile dysfunction. And addressing these underlying issues can improve not just your sexual health, but your overall longevity and quality of life. Another factor that deserves attention is the role of diet in sexual health. What you eat directly affects your cardiovascular system, hormone levels, and energy. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fat supports optimal blood flow and hormonal balance. Foods like leafy greens, berries, nuts, fish rich in omega-3 fatty acids, and even dark chocolate have been linked to improved erectile function. On the flip side, diets high in processed foods, sugar, and unhealthy fats can impair circulation and contribute to weight gain, both of which negatively impact erections. Think of it this way: what's good for your heart is good for your sexual health. Hydration matters too. Dehydration can reduce blood volume and make it harder for your body to maintain adequate blood flow. Drinking enough water throughout the day supports every system in your body, including the one responsible for erections. And while we're on the topic of what you consume, it's important to be mindful of alcohol. While a drink or two might help you relax, excessive alcohol consumption is a known contributor to erectile dysfunction. It depresses the central nervous system and can interfere with the signals between your brain and your body that are necessary for arousal and erection. I'm Dr. Eva Danial, and remember, there's no shame in getting help for your erections. It's not a weakness, it's just a signal from your body that it needs a little support. Talk to your doctor, get the right dose, and don't be afraid to take control of your health. Because when your confidence returns, everything else follows.